We are live. Hey, everybody. Dr. Rob here live. Dr. Rob here live and Dr. Rob here live. I'm excited to be live. We've got, I wish I could show you, I've got about 4 cameras here. We're on all our social channels. I'm excited. Great response last week. That's why I'm back this week. I will come back every Tuesday at 2 p.m. If you guys ask questions, you need some answers, you want to have a conversation. But before we start, as always, as you check in, why don't you tell me where you're from? Let me see where you're from. I've got my screen here. Everybody, let me know where you're from, whether it be New York, Colorado, overseas, what continent? Europe. I'm getting some conversation here. So, had a great time last week talking about some of the different questions. A lot of new information. Going to be doing a live reel coming up on intermittent fasting. Washington Post had an article on that. I want to give you guys my feelings on that. But for today, let me start with the first question of the day. I'm still waiting for some people to tell me where they are, so feel free to chime in. We've got TikTok, we've got Instagram, we've got 3 different Facebooks, we've got LinkedIn, and we've got YouTube. So somebody, we talked about specialized pro-resolving mediators last week. We did that in a reel. They allow for the resolution of inflammation. These particular resolvents are interesting in that they are a conversion from omega-3 fatty acids. They are very unique. I am a big proponent of specialized pro-resolving mediators. I'm a big proponent of managing and modulating inflammation. There we go. We got someone from Colorado. Hey, how are you? You were here last week, I remember. Oh, wow. Bainbridge Island, Washington. Who else? We've got some people here from Mexico. We've got somebody from Southeast Asia checking in. That's fabulous. We've got somebody from New York. Hey, what can I say? Native New Yorker. So somebody had a follow-up question on specialized pro-resolving mediators. It was interesting in that the question is, do vegan forms of SPMs work as well as the fish-derived ones? That's a really good question. And the answer is, first of all, they do have vegan derived. They come from algae, and they are equally as effective as fish derived. And a lot of people ask me, why is that? And the answer is real simple. Fish eat algae. So it's an excellent, excellent choice. So if you need a vegan form or you don't mind the fish oils, whatever you do, they should come from line-caught fish, preferably in Alaska, and they should be converted from omega-3s into those pro-resolving mediators. Great question. We have somebody from Sag Harbor, from Massachusetts. Fabulous. I think we've got somebody else. We've got somebody from New Jersey. I promise I won't make any jokes about that. My wife frowns upon those jokes, so we'll be a good, well-behaved boy. So if you have any questions, anything about health, nutrition, immunity, longevity, sports, yeah, I'm a Knicks fan. Yes, I know they did well yesterday. They won. Feel free to share. Let's get to the next question that somebody had sent in. Are there any, there we go. They've heard the term dysbiosis recently. What does it mean and what does it cause? Dysbiosis. Now, interestingly enough, dysbiosis is the unleveling of good and bad bacteria. You need about 85% good bacteria or more not to have dysbiosis. But really, look at those numbers or hear and feel those numbers. It's fascinating in that you can't have a bad day. So when I used to go to the gym all the time, everybody in the gym would watch what they ate for 6 days a week, but they would pig out on day 7, to use this as an example. They would eat Domino's pizza. They would eat Ben & Jerry's. You can't do that. So the real trick to it all, to not have dysbiosis, is to, if you want to have something like off your menu, you can have it, or if you want to have a meal, you can have it, but try not to make it a day and try not to make it too consistent. Dysbiosis, that's an unleveling of the microbiota. It increases your incidence of heart disease, irritable inflammatory bowel disease like Crohn's disease and ulcerative colitis, liver disease, chronic kidney disease, brain disorders, diabetes, respiratory disease, and believe it or not, dysbiosis with women from the ages of 45 to 60, those peri to menopausal women, decreases estrogen, which when you have a decrease in estrogen, increases your incidence of leaky gut, damages your immune system, increases your incidence of UTIs, also issues with your liver. It really cascades a plethora of different things. So if anything, we want to keep our ecosystem, our gut, rich with good, healthy bacteria. And more so than that, we want to feed that not just with probiotics, we want to feed it with prebiotics. Prebiotics are the food for the probiotic. What is a great prebiotic? Well, great prebiotics are fermented foods. Technically speaking, fermented foods like kimchi, sauerkraut, dill pickles, they're pre and probiotics, and they ultimately make something called a postbiotic. So we have another question here. Dr. Rob, what are your feelings on vibration plate therapy? Well, I'll tell you what, if I had movable cameras, I would go in my rehab room. We have a vibration plate therapy right there. Love it, love it, love it. And why do I like it? For a few reasons. Number one, studies showed in the 1960s that when the space travel became big and everybody was racing to get to the moon, the one problem that the U.S. astronauts had was that when we were going in space, these guys were losing a lot of muscle mass. Muscle mass is a critical element, not just for longevity, but overall health performance. Deeper than that, the Russians were holding on to their muscle mass. Now, obviously, we won the race to the moon. They won the race to muscle mass because they used vibration therapy. So we use vibration therapy as a rehab to hold on to some muscle mass. We use it for lymphatic drainage. So for instance, certain things that we do here, we want to drain the lymphs, and we also do it to help with circulation and proprioception. So my belief, if you could have lymphatic drainage and all of that with vibration therapy, it would be a great, great, great choice. Nobody else? Okay, let's go to number 2 then. Hey, we have someone from Phoenix, someone from Alberta. We're all checking in now. This is working great. I'm excited. Feel free to write questions. I've got my 2 screens. I'm able to answer any questions. Anything goes here. Here we have another one. Serine for cortisol control by exercise-induced stress. Dosage. Is it okay? Should we aim for an animal-based one? You know what? That is one that I don't have a good answer, but here's what I'll share on serine. Serine, it was 30 milligrams, had a great outcome to quell a lot of the symptomology in Alzheimer's. So phosphoserine is a great choice. That was the dosage. Animal-based one, I will get back to you. Everybody, let's make note of that question, and I will add some information to that. Hey, Doc, can you please talk about glutathione? Why is it important? Who needs it most? Thank you very much in advance for your answer. Well, thank you for asking the question. Glutathione, the master antioxidant. If vitamin C, one molecule, can kill 3 free radicals, it's a pretty effective antioxidant. Vitamin E, one molecule, is known to kill 5 free radicals. Glutathione, or liposomal glutathione, because you want it in a liposomal form so it can get into the cell. If glutathione can get into the cell, 1 molecule of glutathione, drum roll please, 1 million free radicals it can kill. So it is the master antioxidant if it can get in to the cell. The best form to have of glutathione is liposomal. Glutathione is also great because in concussion studies in 2014, it was shown to decrease brain tissue damage by 70%. Glutathione decreases as we age. Tight junctions, leaky gut increase as we age. So there's an inverse relationship. I think one of the secret sauces, having a good, healthy gut, is to supplement with L-glutathione. So that was a great question. Feel free to ask more. Some people say, well, if it's not L-glutathione, what is the key antioxidant after that? And believe it or not, I would have to say astaxanthin. All right, let's move on. What is neuroplasticity and how does it affect positively? So let me read that question again. I move. What is neuroplasticity and what does it affect? The neuroplasticity is interesting in that the brain is neuroplastic. So you can retrain your brain. So where you are today, where I am at my age, I can improve my IQ. I can improve my quotient, and I need to do both. I can improve my balance. I can rewire my neurons. So they call that brain neurogenesis. They've known this for 50 years. There was data that was published 32 years ago, 2013. They talked about brain neurogenesis and neuroplasticity. So what increases neuroplasticity? Well, exercise is a great choice. Exercise, whether it's aerobic, resistance, or the preference is the combination, is a great choice. Exercise releases a protein enzyme called BDNF, brain-derived neurotrophic factors. It actually is released from the gut and goes to the brain. No surprise there. That gut-to-brain axis is in tow, and you're able to increase your ability for neuroplasticity. In addition, the ketogenic diet, the Mediterranean diet, caloric restriction, obviously intermittent fasting, omega-3 fatty acids, curcumin, green tea, all lead you down a path of increased neuroplasticity. Getting good sleep also will help. Physical activity. So what are we talking about? All quality supplements, exercise, getting sleep, lifestyle. So for me, longevity, neuroplasticity. Neuroplasticity, longevity. I think they're virtually synonymous. So let's get back to the screen. Let's see what we have here. Ooh, we've got a long one here, everybody. What would you go to for male prolactin issues? Not severe, but consistent, no steroid induced. Well, my answer for that, and that's a great question about male prolactin. I know this sounds funny, but when there are hormones that are changing in males or females, I always go to the gut. So let me know. Put in your email address, and I will send you a PDF of my book. Chapter 5 has my Super 7R action plan. You follow that, life will be grand. I've got a long one here. Let me get to this. Thank you, Dr. Silverman, proud American survivor, brain injury survivor, TBI survivor, 5-inch head scar. Sorry about all that. Thanks to American Pro Physical Rehab Center, established in 1998. Just lost you for a split second. You want to help me with that? Can anybody see? No. Okay. So I'll show it. Okay. So rehab. So essentially somebody's doing a lot better after a really horrific injury to their brain, TBI, got a lot of brain protocols, got a lot of concussion nutritional protocols. One of the things that I use post-concussion TBI is low-level laser therapy. Everybody knows I'm an Laconia guy. If you need any information, feel free to reach out on me. If you reach out to me. That's the beauty of being live. You get to be raw and you get to watch your mistakes live. It's fabulous. In any case, I've used the low-level laser, non-thermal laser for great outcomes with people with TBIs and concussion. Some of the nutrients that I would recommend post-concussion would be magnesium L-threonate, 2 grams per day. Please take it divided doses. There's your pro-resolving mediators, a great choice, your pro-resolving mediators, because they decrease inflammation in the brain. Omega-3 fatty acids is a great choice. Here's a factoid. 75% of the damage post-concussion can get attenuated by taking 2 to 4 grams of omega-3 fatty acids. Which athlete is the #1 athlete to get a concussion? Well, drum roll again, female soccer players. So if you have any high school, college athletes, you should put them on some omega-3 fatty acids. That's number 3. As we said before, L-glutathione, and believe it, vitamin D is a great choice. Hold on a second. Vitamin D is a great choice to add to your concussion protocol. So another question wrote in, do we need fiber? Fiber is the longevity jam, without question. The average American consumes 18 to 15 grams of fiber per day. You need 35 to 50. When you increase your fiber intake by 10 grams, you decrease your mortality rate by 20%. Fiber is a great prebiotic, and we already talked about pre and probiotics. I got your email. Let me go down over here. All right, let's go back in here. So somebody wrote in, are there any new findings and studies to share? Well, I got 3, believe it or not. We have one that's not brand new, but it's a couple of months ago. It's called the Cosmos trial. It's 22,000 participants were given daily coconut extract and multivitamin supplements. So they gave the coconut extract 500 milligrams, and it favorably impacted clinical cardiovascular outcomes, including a significant 27% reduction in cardiovascular death and greater cardiovascular benefits. Daily multivitamin, multimineral, which I believe everybody should take. Everybody should take a methylated multivitamin, showed to, for 3 years, improved in older adults, global cognition, episodic memory, executive function, and believe it or not, the multivitamin, multimineral benefited adults with cardiovascular disease. On TikTok, tell them to tap on the screen for likes. Guys, I'm getting told by my team, tap on the screen for likes. Tell your friends. Come on. Tap, tap, tap. Here's one that's real true to my heart. The cost of spine-related pain in the U.S., back pain, is estimated to be about $135 billion per year. Interestingly enough, there was 44 studies included in this particular article, and the takeaway was they found out that muscular-related lower back pain, is there any other kind, when you went primarily to the chiropractor or initially to the chiropractor, he saved you money at the initial cost. Downstream costs, outcomes were better than any other alternative practitioner. So please don't think I'm being biased because I'm a chiropractor. The numbers bear out. If you have lower back pain, 8 out of 10 Americans have lower back pain. Your first choice in many to most instances should to seek out a chiropractor. And that chiropractor should be very well skilled in spinal manipulation, soft tissue, assessment, low-level laser treatment, possibly decompression, possibly dry needling, taping, and of course, he should always integrate, or she should integrate lifestyle, functional nutrition, functional medicine, because I believe a chiropractor is a holistic practitioner. They can look inside the body because health is what's inside, not just what is outside. Another new article trying to answer that person's question that really caught my attention was the combination of vitamin D and calcium. There was a study of virtually 37,000 postmenopausal women, double placebo test over 7 years. They waited 22 years and they tested, and it revealed the test from the people who took the supplements versus the non-supplement users. And here it was, 7% reduction in cancer-related deaths, 19% reduction in invasive breast cancer, and 31% reduction in colorectal cancer. That was D3. It was 400 IUs. There's no flipping way I would ever use 400 IUs. Give me a break. I would use nothing less than 2,000 IUs, and I usually use anywhere from 2,000 to 5,000 IUs. Yet at that very entry, low level, they still got a positive outcome. In addition to taking calcium, they took calcium carbonate. Double Jeopardy says wrong answer. Wouldn't take calcium carbonate. I would take MCHC. That said, they still got outcome. But here would be the secret sauce, other than using a different form and a higher dosage. You should add K2, vitamin K2 to that formulation. K2 to the formulation, what does it do? Well, here is the answer. K is the compass for vitamin D. It tells vitamin D where to carry the calcium to or where to direct it. It does so by taking K2 to vitamin D, tells calcium to go to the bone where you want it. Without the K2, the vitamin D can take calcium to soft tissue and you can have plaquing. So the secret sauce behind the combination of vitamin D and calcium would be the addition of vitamin K2. Carnivore diet, your take. Well, here's my take. I believe that any diet that you switch to over the standard American diet, which is the worst diet in the world, that's why the acronym is SAD, Standard American Diet, is better. Am I a carnivore fan? Please all don't get angry. Not enough fiber in the carnivore diet. So as a switch from the standard American diet, it's better. Is it a choice diet? Probably not, because of the lack of fiber. In addition, everybody always asks me which diet, Mediterranean, ketogenic, paleo, flexitarian, blue zones diet, etc. For me, the best diet is what I'm able to do for you, in that I want to individualize and personalize it for your needs, your goals, your outcomes. So, everybody, I love the pop in and pop out really quickly. I really appreciate all that you do. Let me double check the board. Okay. I look forward to seeing you next week. I'll be here at 2:00 p.m. on Tuesday. Please let your friends know. We saw a great growth in people today. My name is Dr. Rob Silverman. Always yours in health.